Hi, everybody. Thank you so much for having me and Mindy tonight. It's a rainy day outside of my window, and so it's nice that you guys have all joined us to hear a little bit about Alzheimer's, dementia overall, and the link to nutrition, how you can try to keep yourselves healthy. So, as we go on our conversation tonight, I'm just going to start off with a very broad explanation of what dementia is overall. So, dementia is a decline in cognition, which involves one or more cognitive domains. These domains can include anything from learning and memory to language, executive function, complex attention, perceptual motor, and social cognition. So no one patient with dementia looks exactly like another. They may have varying degrees of capabilities within these domains, but the hallmark is that there is some loss of function in at least two of these. Alzheimer's disease is a type of dementia. So whereas dementia you can think of as sort of the overarching syndrome, Alzheimer's is one type. It does happen to be the most common type, and we'll talk a little bit about why that is and what that might look like. There's a couple of types of Alzheimer's dementia in and of themselves. The ones we're going to talk about mostly tonight is just typical Alzheimer's disease. You can also have early onset, inherited, where it's very much passed through generations, and then Alzheimer's disease is also associated with those with Down syndrome. Those last three are not the ones that we're going to talk about tonight. We're really going to mostly focus on typical Alzheimer's disease. It's very common in the aging population, and essentially every 5 years that you get older, over the age of 65, the prevalence, meaning how common Alzheimer's disease is, doubles. So if you have a cohort or a group of 65-year-olds, and then you look at the same group of 70-year-olds, by the time they turn 70, half of them that didn't have Alzheimer's will now have some signs of Alzheimer's. So as you get older, it becomes much more common. This is just a short video. We're not going to watch the whole thing, but I think it helps explain what Alzheimer's does to your brain so that we can then understand how we can treat it and maybe even how we can try to prevent it from causing havoc.
In healthy people, all sensations, movements, thoughts, memories, and feelings are the result of signals that pass through billions of nerve cells or neurons in the brain. Neurons constantly communicate with each other through electrical charges that travel down axons, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, the most basic form of dementia, toxic changes in the brain destroy this healthy balance. These changes may occur years, even decades, before the first signs of dementia. Researchers believe that this process involves two proteins called beta amyloid and tau, which somehow become toxic to the brain. It appears that abnormal tau accumulates, eventually forming tangles inside neurons. And beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. The vascular system may fail to deliver sufficient blood and nutrients to the brain. The brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate. As neurons die, the brain shrinks, beginning in the hippocampus, a part of the brain important to learning and memory. People may begin to experience memory loss, impaired decision-making, and language problems. As more neurons die throughout the brain, A person with Alzheimer's gradually loses the ability to think, remember, make decisions, and function independently.
All right, so the reason that I wanted to show you that video is to highlight a few things. First off, that the process starts well before anybody experiences any symptoms of Alzheimer's disease. And so when we think about how to prevent something that maybe has been in progress in our brains over many, many years, that can kind of get a little bit difficult because you have to prevent it before you even know that you have it. The other thing that I wanted to point out was that as your brain becomes sick, your symptoms become much more significant. And so the early signs and symptoms of Alzheimer's, which we're going to talk about next, are important to kind of pick up on so that we can hopefully delay the progression to when somebody becomes very ill with it. Oops, hold on. There we go. So the first and most common symptom in Alzheimer's disease is memory impairment. And so when people think about aging and memory, a lot of people get worried probably a little bit too early. And so interestingly, when you think about how somebody loses their memory in Alzheimer's disease, it typically happens in an episodic nature. So it's not that you're going to tell them a word like repeat after me and ask them to say fish, and they can't say fish back to you. They almost always will be able to. But if you ask them to say, what was that word that I said to you 20 minutes ago, that's when things might get more difficult. Might start forgetting things like what they had for dinner the night before, what they did last weekend. And these things will happen in episodes, not necessarily all of the time. So they can often be ignored or sort of thought to be something else, stress or something like that. Early in Alzheimer's disease, that immediate recall is intact. And so it is absolutely there. And a lot of times people feel better about themselves because, oh, look, I can remember things. You tell me a phone number and I can repeat it right back to you. That's actually not a sign of Alzheimer's disease. The other thing that happens early is that people start to lose their procedural memory and motor learning. That happens much later, but initially you might have problems with executive functioning. So very young and healthy people, probably still working at the age of 65, 70, 75, might start to notice some difficulties at work, which we'll talk about in a little bit. So the signs in the beginning are not continuous, they're episodic, and they're not immediate recall. It's, recall over hours, days, weeks that gets affected. Long-term memory is preserved in Alzheimer's disease for a very long time. And so long-term memory loss is not an indication of Alzheimer's disease. I talked a little bit about the executive functioning, which is one of the things that's lost early on. It's often present, but not reported. And that's because usually we're pretty good at making up for it. So there's two main areas that you can be affected by this, and that's in your organization and then also your regulation. So organization is attention, planning, problem solving. So you want to make spaghetti and meatballs for dinner, and you go to the store and there's no red sauce in the store. Somebody who has difficulty with organization may sort of freeze up in the store and go home empty-handed and say, well, they didn't have what I wanted to make for dinner, so now I can't make dinner. Whereas somebody with an intact organization system and good executive functioning would be able to pivot and say, okay, tonight I'll have Alfredo sauce instead of red sauce. When we have normal brain functioning, that seems like an obvious thing, but it's actually really hard and it takes a lot of planning to be able to do things like that. The other thing that's really important about assessing this or seeing if somebody that I love starting to develop these signs or symptoms is to think about how they've always been. If you have somebody who has always been a poor planner, could never get through a shopping list without forgetting something, and then they're in their 80s and they're forgetting things at the store, you really can't say that that's a new problem for them. So it's much less concerning. If you had somebody who was very organized, always had their list, could always pivot on the spot, and suddenly they can't, then that's much more concerning. So knowing what someone's prior level of functioning is very important, because not all of us are made equal. The other things, I just like to give some examples when I talk to communities and also patients about other areas where you can see this problem. Overdrafting on bank accounts, right? So if somebody was always very good at keeping a checkbook and now suddenly is having some overdrafts, that would be a concerning sign that maybe their executive functioning or judgment is off. Wearing climate appropriate clothing. So as it gets colder out, wearing a jacket. As it gets cooler, making sure you have a hat on and things like that. Difficulty starting tasks that you used to be able to do. This one we see a lot in people with cleaning. So they know that they want to clean their bathroom. They go in the bathroom to clean it. And it's not that they forgot what they were going to do, but they get there and they can't find the cleaning supplies. So they give up the task altogether and they say, okay, maybe next time I'll clean the bathroom, and they move on. That's not something that somebody with a normal level of executive functioning would do. And then other less common areas that we can see this are things like spending too much money or just acting in ways that aren't typical to yourself. So this picture that's on the slide here, this is called a Trails B test. And the reason that I show this is because this is one of the tests we do when we're evaluating people for if they have problems with memory, executive functioning, and judgment. It's actually a really hard test for people to do. And so the way that it works is you explain to somebody that they're going to start with the number 1, and then they're going to follow it, make a line to letter A. Then they're going to go to number 2, and then they're going to continue in that pattern until they get to the end. So letter, number, or number, letter, number, letter. That takes a lot of organization and focus to be able to do. And so when somebody can't start to do these more complex tasks, this can be one of the really early tests that can start to be impaired. And you can get this done sort of at your primary care doctors or any of the other people that we're going to talk about in a little bit. The next early sign of Alzheimer's disease is a visual spatial abnormalities. And this is really something that starts to happen in sort of the, not as early as the memory problems or the executive functioning, but not as late as when people start to get very ill with it. You might notice this as somebody falling more often, somebody getting lost, right? They're maybe driving and they end up on the street next to theirs instead of their street, but they can't quite figure out how to get back to where they want to be. You might lose the recognition of objects or faces, can't recognize that this is a pen, or more appropriately, can't recognize what to do with the pen, that it's a writing instrument. Might have trouble reading, because reading actually takes a lot of ability to focus your eyes and move them in a sequential pattern. And so if you're having trouble with visual spatial identification, then reading would be something that's more difficult. The reason that this cube is here is because one of the ways that we test for this abnormality in people who have dementia or Alzheimer's is we ask them to draw a complicated shape, either drawing a cube, connecting 2 pentagons, which are 5-sided objects, and seeing how they can sort of figure out in their brain how to do it. A frequent thing that I will have people say to me when I run this test is, oh, I've never been an artist. And I try to just encourage them that this is not about how good it looks. I just want to see if you can make sense of the shape and redraw it. Some of the later signs, which I think are the more obvious signs to us, not only because there are more people living with Alzheimer's longer and longer, but also because the early signs often lead to misdiagnosis or delayed diagnosis. And so many people can live for a long time with Alzheimer's disease, not knowing that that's what they have. And so once somebody receives a diagnosis, oftentimes they're already in this later signs and symptoms category. So this often can show up as things like depression in people as they get older. They may start to pull away from things they used to enjoy, go to less events with their friends, spend more time alone and inside. Usually social disengagement is a really important thing to keep an eye on. And so if there's loved ones that you're looking out for and that you're kind of worried about, getting them out and going out to lunch, going on a walk, spending time at a senior center can be really, really helpful in sort of limiting the effect that this disease may have on them. Dyspraxia is a big fancy word for somebody saying that they don't know what to do. So like the example I gave with the pen, they might not know what a pen does, or you'll give them a spoon and expect them to eat with it, but they don't. Maybe they write with it, or they're not sure how to use it. So those things can start to happen as well. Sleep disturbances become more and more common as people advance with the disease. Oftentimes people will start to mix up their days and nights. They'll spend more time awake during the nighttime and more time sleeping during the day. They might sleep in spurts of a few hours and have a very fragmented amount of sleeping that they're doing. And then sometimes, there's been some evidence that the sleep disturbances can actually happen much earlier and are another sort of overlooked sign, but they're certainly predominant in the later stages of Alzheimer's disease. So how do we evaluate people with this, and what should you do if you're worried you might have Alzheimer's or some sort of dementia, or a family member might have Alzheimer's or some kind of dementia? So the first thing to do, I'm a primary care physician. That will always be my number one thing, is to say, go see your primary care doctor. They've likely known you for a long time. They know what your baseline is. And even if they don't feel that they can do the testing that you need, they certainly will know who to refer you to and who to send you to. There are a number of in-office memory tests that your primary care doctor or a specialist can do, such as a geriatrician like myself, a neurologist or a brain doctor, or a neuropsychologist who's somebody who specifically kind of evaluates brain disorders through a series of testing that might take 3 or 4 hours. It is extremely helpful in difficult to figure out cases, especially when people are younger or they don't have typical symptoms. So those are probably the number one thing to do, is start with your primary care doctor and then move on from there based on their recommendation. I'm going to spend just literally a couple of seconds talking about this, because this is not the point of today's talk. There are ways that we can diagnose Alzheimer's disease. So we used to say it's a diagnosis that can only be made on autopsy. It's not quite the case anymore. We can officially make the diagnosis before an autopsy. However, it's not quite in practice yet regularly, and we'll talk a little bit about why that is when we talk about what treatment options there might be. But there are ways that you can get it tested, but not quite the way that we actually use it. Most of the time, this is just a clinical diagnosis. You see your doctor, they say you have typical signs and symptoms, and this is what we believe is going on. All right, so treatment options for Alzheimer's disease. So, there's a couple of things that we can do. One are these cholinesterase inhibitors. There's a couple of them, donepezil, rivastigmine, and galantamine. They come in a variety of different formulations, meaning you can wear a patch, you can have a dissolvable tablet, you can have a tablet that you swallow. Those are used at any stage of Alzheimer's. So you can use it right when you first get diagnosed, all the way up until the time when you have late stage disease. The goal of these medicines is not to cure the disease. It is simply to provide symptomatic improvement. And so what I mean by that is that when you test somebody before they start a medicine and you test them after they start a medicine, there does seem to be some improvement. So their memory may improve, their executive functioning may improve, but they will improve symptomatically. Unfortunately, the disease will still continue to progress. There is currently no available curative option. NMDA receptor antagonist called memantine. That medicine is used in people who are a little bit more advanced, not in the early disease, and that's something that we use often when people have depression along with dementia or some other, neurologic symptoms. And then, and this is the only, suvorexant is actually the only sleep medication that's approved in patients with Alzheimer's disease. And so if somebody is really suffering with that fragmented sleep, this is one medicine that you can try. So the next slide, we're going to talk about kind of the hot topic with Alzheimer's right now. So the new medicine that's available, is called Adukanumab, and it is a monoclonal antibody, which thanks to the COVID-19 pandemic, all of us have some kind of understanding of what that might mean. But basically, it attaches to beta amyloid plaques, and the idea is that it is going to slow down how much they can sort of like grab onto each other and make those issues that we saw that eventually causes your brain cells to die. And so the people who would be using this medicine are going to be people who are very early in the disease. They don't have a lot of symptoms. Maybe they have some slight executive functioning problems or memory problems, but overall they're very well functioning. It's a very controversial medication. The reason it's controversial is because it's new, and so most new things are controversial sort of in and of themselves. But also what the studies that were done to get this medication approved were able to show is that it decreased the amount of beta amyloid plaques. Great. It did not show, because obviously they have not had it around for 30 or 40 years, that those people don't develop as severe dementia, or that they develop dementia at a less rapid pace than people who aren't on it. And so while it's very exciting for the community who cares a lot about people with dementia and who takes care of them, because we haven't had anything since 2003, it's not quite the magic bullet that we were hoping for yet. It very well may be, we just don't know that yet. It is FDA approved, but it's only really available through trials. So I can give the department the link on alzheimers.org. It's a wonderful website where you can actually just like search where you live and what Alzheimer's trials might be available, so that you can see if going into one of these trials might be something you want for yourself or a loved one. Everybody always asks about alternative treatments and all diseases, whether it be Alzheimer's or high blood pressure or menopause. And overall, they are really not recommended. They're not FDA approved, and there has been no evidence that any of the supplements that are out there that are marketed for memory protection are actually effective. So I do not recommend them. Just some names of the things that are not recommended would include things like vitamin E, estrogen, anti-inflammatory drugs, ginkgo biloba, vitamin B, and omega-3 fatty acids. There's another big one out there. I'll save myself a question later, called Prevagen. Also not recommended, not found to be effective in clinical trials. So why are you here today? You're wondering, what can I do? Is there anything I can do that will help my memory as I get older and as I age? The only thing that actually has full evidence and is backed by science is exercise, staying active. And I call that staying active with your body, but also your mind and socially. So getting out there, being in groups of people, going on walks, those are all the things that you can do to help your memory. It will not prevent Alzheimer's if you have Alzheimer's. Remember, you've had the predisposition to have Alzheimer's for many, many years. It's not something that, we can prevent at this point. The other thing that the video said was that other insults to your brain can cause damage. And so you want to keep your brain healthy. And the way that we do that is by preventing heart disease and preventing stroke. Because anytime that we prevent heart disease and stroke, we make it much less likely that your brain will have another injury that will lead to worsening symptoms of dementia, whatever kind it may be. You want to avoid head injury, sleep well, stay social. And then one of the exciting things is diet, and that's what Mindy's going to talk about. So there is some evidence out there that certain types of foods and certain types of diets can help your brain stay healthy. Again, we can't prevent Alzheimer's, but we can keep you as healthy as we can to prevent you from getting it very severe or even slow down the progression. So that's the part of our next talk, and I'm really happy to introduce Mindy to be able to talk to you all about that. Okay.
Thank you, Dr. Carcia. Well, I'm going to start sharing my screen. Okay, can everyone see my screen okay?
Yes.
Yes, thank you, thank you.
You're
So
welcome.
good evening, and thanks for joining us tonight. Actually, can you see me as well? Do I have my camera back on? All right, great. And that's just fine. Okay. Yeah, thanks for joining us tonight. And thank you, Dr. Carcia, for that great introduction to my part of the presentation. I really learned a lot. And I think that it's a great intro for what I'm going to be discussing, which is the mind eating plan. And did you know that there actually is an eating plan that was designed and studied by researchers that have been shown to help protect our brain? And what I really liked about this plan, or I guess I could think of it as a plus, is that the foods that are recommended to help with brain health are many of the same foods that have been shown to decrease the risk of many other health issues. So the benefits of this plan may boost your overall health as well. So first, why the mind plan? Life expectancy has increased. People are now living longer. As we age, we often have difficulty remembering, thinking clearly, making decisions, and controlling emotions. And the mind plan aims to reduce dementia and the decline in brain health that occur as people get older. So what is the mind plan? MIND, M-I-N-D, is an acronym for Mediterranean-Intervention for Neurodegenerative Delay. It combines aspects of two very popular eating plans, the Mediterranean plan and the DASH plan. DASH is an acronym that stands for Dietary Approaches to Stop Hypertension. And both these plans have been recommended before the MIND plan. They were both recommended to lower blood pressure, lower blood fats, such as cholesterol, to reduce the risk of heart disease and strokes, to help reduce the risk of many types of cancer. They may reduce the risk of developing type 2 diabetes or help manage diabetes. They may decrease arthritis and overall increase longevity. And I think what Dr. Carcia discussed about how if we can reduce the risk of heart disease and stroke and blood pressure, right, and fats, that's how these plans might actually help to reduce our risk of dementia. So both of these plans, the DASH plan and the Mediterranean plan, are associated with lower levels of oxidative stress and inflammation, which are often the causes of many chronic diseases. Oxidative stress occurs when free radicals, which are unstable molecules, they're known as the bad guys, when they accumulate in the body in large quantities, they cause damage to the cells and can lead to illnesses in the aging process. And the brain is really quite vulnerable to this type of damage. Inflammation is your body's natural response to injury and infection. And if not properly regulated, inflammation can be harmful and contribute to many chronic diseases. Researchers believe that the antioxidant and anti-inflammatory effects of the foods encouraged on the mind eating plan may help lower the risk of dementia and slow the loss of brain function that can occur with aging. So we talked about how the free radicals are the bad guys. Well, the antioxidants are the good guys. They help neutralize the free radicals. They act as a natural off switch for the free radicals. And this just helps break the chain reaction to stop the damage to cells. Okay. And you've probably heard of many of the well-known antioxidants. They would include beta-carotene and other carotenoids, lutein, resveratrol, vitamin C, vitamin E, lycopene, and there's many others. And I don't want to overdo the science involved, but I always feel when I understand how something works or how it may be helpful, it makes me more likely to follow through on the plan. And just a few more words on inflammation before we get to the foods to include. Keep in mind that no food can be considered an anti-inflammatory miracle. However, some foods have the capacity to decrease inflammation. And current science overall encourages good nutrition to help enhance our body's immune system and provide antioxidants to reduce the inflammatory stress. Okay, so basically the Mind Eating Plan, the way it works is it emphasizes foods shown to support a healthy brain and recommends limiting those potentially damaging choices. And as a side note, the Mind research, the research on this original plan was originally published in 2015, but it's still being studied. A study in 2021 showed that the Mind plan may have protective effects against Parkinson's disease. And I also recently read that the Mind Eating Plan shows promise in reducing the risk of migraines. Okay, so more positives. So first we'll discuss the foods to include or increase, and then we'll discuss the foods that are recommended to decrease. So what are the 10 foods to eat on the Mind plan? Green leafy vegetables, other vegetables, berries, nuts, olive oil, whole grains, fish, beans, poultry, and wine. And the overall goal is to include more of these foods, which I like about this plan because I believe that people do better when they focus on what to add rather than focusing on what to avoid. And if you're unable to consume the targeted amounts of servings, which we'll discuss on the following slides, don't quit the Mind plan. The study found that the plan lowered Alzheimer's risk by about 35% for people who followed it moderately well, and up to 53% for those who followed it rigorously. Okay, so the closer it was followed, the better the impact. And keep in mind, you can eat more than just these 10 foods. So after I talk about what foods, we'll go a little depth into those foods that, that the Mind Diet encourages us to consume. Then I'll talk a little bit more about strategies to help add them to your day. So first up on the list was the green leafy vegetables, and the goal is to eat a serving every day or 6 or more servings per week. And a serving size is 1 cup raw or 1/2 cup cooked. So this would include your leafy greens such as spinach, kale, broccoli, cabbage, Brussels sprouts, collards, Swiss chard, turnip greens, and salad greens such as romaine, arugula, spring mix. I also consider baby spinach to be a salad green. Really, so can kale or any other vegetable, especially if you shred it. The goal for the other vegetables is at least once a day, and that's in addition to the green leafy vegetables. These would include the non-starchy vegetables such as carrots, green beans, cauliflower, asparagus, bell peppers, onions, tomatoes, eggplant, zucchini, beets. I'm sure I probably missed some. And it also includes the starchy vegetables such as potatoes, corn, and peas. And the serving size for vegetables is 1/2 cup. Okay, and we know plant foods are just really excellent sources of antioxidants. Okay, next up, berries. Berries are naturally high in antioxidants. Blueberries are especially powerful, they say, because they contain the antioxidant known as quercetin, which has strong anti-inflammatory properties. And the goal is to eat berries at least 2 times a week. And the serving size is 1/2 cup of fresh or frozen. Nuts. The goal is 5 servings or more per week. And the portion size would either be 1/4 cup of nuts or 2 tablespoons of a nut butter. And while all nuts do have antioxidant properties, walnuts contain almost twice as many antioxidants as the equivalent amount of most other nuts. Pecans and almonds are also great choices. You don't want to overdo nuts. They're very healthy, but they are high in fats and high in calories, so it could add up. And only 7 walnuts a day is all it takes to really get the health benefits. Try to use olive oil as your main cooking oil and for salad dressings. And the recommended serving size was 2 teaspoons and 2 servings a day. The goal for whole grains is 3 servings per day. And that would include things like your oatmeal, quinoa, brown rice, barley, whole wheat pasta, 100% whole wheat or whole grain bread. And the serving size is either 1 slice of bread or 1/2 cup of rice, pasta, quinoa, or other grains. Beans are very high in protein and fiber. Black beans are especially high in antioxidants because of their dark skins. And the goal is to include at least 4 meals, included in at least 4 meals per week. And the serving size is 1/2 cup cooked. And you could use dry beans and soak them, or you can use canned beans. I just recommend draining them and rinsing them off. But this would include all beans such as chickpeas, kidney, navy, white, black, etc., lentils, and also soybeans. Okay, now fish. So the goal for fish is to eat at least once a week, and the serving size is 3 ounces. And this would include your fatty fish for their high omega-3 fatty acids. So even though we don't recommend supplements to get your omega-3 fatty acids, eating fish is a great protein to include. And this would include fish like salmon, tuna, sardines, trout, mackerel. Okay, research shows that the omega-3 can help reduce inflammation and also lower blood cholesterol. Okay, as far as poultry, the goal is to eat chicken or turkey at least 2 times a week, and the serving size would be 3 ounces. And although deep fried chicken is not encouraged on the MIND diet, and we'll talk a little bit more about that in a moment. Wine. The goal in the MIND plan was 5 ounces per day. And keep in mind that many of the wine glasses that we use are large, or we tend to fill them too high. But as far as the MIND plan goes, more alcohol does not improve health. So whereas, eating more greens might, prove to be healthy, having more alcohol did not on the MIND plan. Excess alcohol consumption can negatively affect your health. And the MIND plan recommended both red and white wine. However, research mostly focused on red wine because it has a compound called resveratrol. And if you don't drink alcohol, you can try grapes, which also contains resveratrol. And also keep in mind, of course, that alcohol is not recommended for everyone. It would not be recommended for individuals with certain risk factors, for example, alcoholism, breast cancer, liver disease, or fatty liver, or if they are pregnant, or check with your doctor depending on certain medications. Okay, so now we get to the little bit of the negative part. So what did the research show are foods that we should be cutting back on? There are 5 foods to limit on the MIND eating plan. Butter and margarine, cheese, particularly the high fat or full fat cheese, red meat, fried food, pastries and sweets, including soda and sugary drinks. And the reason for this is these foods contain saturated fats and trans fats. And research has found that trans fats are clearly associated with all sorts of diseases, including heart disease and Alzheimer's disease. The research on saturated fats are a little less clear, but animal research and observational studies suggest that consuming saturated fats in excess is associated with poor brain health. They tend to turn on the inflammatory processes. So it's advised to decrease foods that are high in saturated fat. So the goal for butter and margarine is to eat less than 1 tablespoon per day. Instead, try using olive oil as your main cooking oil or fat. You can even try dipping your bread in olive oil with herbs. And when you use these fats, just spread them thinly. I do like, Land O'Lakes makes a spreadable butter, and it's actually a combination of regular butter, but with olive oil, or there's also a canola oil version. But I like them because it does have about half the saturated fat as stick butter, but it still gives you that buttery taste. And because it's a little softer, it's easy just to skim off a little bit at a time and use less. Limit full fat cheese to 1 ounce per week. Reduced fat cheeses are likely better choices. Generally, I don't go for the fat-free cheeses. To me, they're not really cheese, and they have to add a lot of other ingredients in them to make them seem like cheese. But the reduced fat cheeses usually are just made with reduced fat milk. Red meat, especially processed meats like hot dogs, sausage, and bacon, they're particularly high in saturated fat. So the goal is to aim for no more than 3 servings each week of red meat in these products. fried food. So the goal for fried food is to limit to less than once per week. So it's, again, what I like about the Mind eating plan is it's not saying to avoid things, but to definitely eat less, especially the kind that comes from fast food restaurants. The fats that they tend to use in those types of meals are not olive oil. They tend to be higher in saturated fat and sometimes trans fat. Pastries and sweets, the goal is to limit to no more than 3 times per week. And this would include ice cream, cookies, brownies, cake, donuts, candy. I always say portion size really is the key. And part of that is because think about what happens when you're told to avoid something, when you're told you can't have something, or when you even just feel I shouldn't have something. I think for many of us, we often want it more, or we avoid it for so long and then we want it and we tend to really overdo it. So again, it's not that you should never eat these foods. Think of it as incorporating more of the foods that provide health benefits, and you'll likely be able to reduce your consumption of some of these treats to a level that lets you achieve that balance. And if you tend to eat a lot of these foods, just find other Mind foods that you may enjoy substituting them with and gradually decrease how often you eat them or the portion sizes. Now that you know what foods are healthy for your brain and body, but now we really need to incorporate them in, right? The goal is really to incorporate them into our day. So it's helpful to plan how you're going to do this, to make sure you put them on the shopping list for one. And then I just wanted to give you some other strategies. I think a really easy way to add more of those dark green leafy vegetables and to meet your goal of the 6 to 7 days a week is to buy the bags or containers of fresh greens. My favorites are the baby spinach, arugula, and spring mix. You could also make quick and simple salads with them. You can put them on sandwiches or just put them on your plate with a drizzle of olive oil and vinegar or lemon juice. You can add them to hot dishes such as pasta or soups. You can saute them like spinach in a little olive oil and garlic. But I find it's just so easy to take a handful from the bag or from the container and add them to your plates. Again, whether it's just, as a side salad, or I do add them to, to soups and to other hot or big dishes. You mix them in and they really just kind of steam right away. Salads are a great way to include many of these Mind foods. These examples include several of the Mind foods. The top salad contains baby kale with chickpeas and olive oil. The easiest salad that I make often is baby spinach with just some nuts like pecans or almonds or walnuts. Maybe I'll add a little bit of craisins or raisins to it for a little flavor. Adding berries and nuts to a salad checks off, 3 Mind foods in one meal. Try adding black beans, tomatoes, corn, and avocado to your greens for a little more hearty salad, as the pic on the left. You can add chicken or tuna fish to add a Mind protein to your salads, or hard-boiled eggs. Eggs are actually very low in saturated fat, so that would be an easy source of protein. In the pic on the right, there are actually 4 Mind foods in this one meal, right? There's the dark green leafy, there's the berries, there's walnuts, and there's the chicken. And then if you add some olive oil in the dressing, really there's 5 Mind foods right there in that one plate. A good goal is to include lots of non-starchy vegetables. And one of my favorite ways to prepare vegetables, especially this time of year in the fall, I just started really doing it, roasting them again. Just put them on a pan, drizzle them with some olive oil, put them in a hot oven, generally 425 degrees for about 20 to 30 minutes. Usually I'll flip the vegetables over at the halfway point and just roast them till they get a little browned and caramelized. You can add whatever seasonings you like. Cooking vegetables in ways that are more enjoyable will likely make it easier for you to eat more of them. Another tasty way to cook vegetables is to saute them or stir fry them in a little olive oil. You can use fresh vegetables or even frozen vegetables for sauteing. And can you see the sliced almonds that were sauteed with the green beans in the bottom left picture? And keep in mind, frozen vegetables are just as healthy as fresh vegetables. Even canned vegetables can be a quick way to add vegetables to your plates. Just rinse or drain them off the liquid if they're packed with salt. You really just, I want people to go with what fits into their budget and their lifestyle. Microwaving or steaming are healthy ways to cook vegetables as well. Just be careful that you're not adding lots of butter or cheese to make them, tasty afterwards. Raw vegetables make great snacks or served as a side dish with lunch or even dinner. If you wash and cut the vegetables ahead of time, you'll be more likely to eat them for a snack or for a meal. Because oftentimes when we're looking for something to eat, if we have to first go through the process of getting them out of the refrigerator and washing them and cutting them, we might more likely grab the chips. But if the vegetables are already cut up, you might actually choose them for a snack, or at least part of it. You can buy berries fresh or frozen. You can eat them on their own as a snack, or add some to yogurt, to cereal, to salads, or in smoothies. I like to sprinkle even just a small amount of granola cereal on my berries and some sliced almonds. And I find it makes a really good sweet treat and an alternative for some of those, pies and things like that. Nuts make great snacks, or you can add them to oatmeal or salads, or to roasted or sauteed vegetables. And you can carry them with you. They don't require refrigeration on your little trips or errands. As far as whole grains, you want to try to include quinoa, oatmeal, especially the old-fashioned or steel-cut, brown rice, whole grain crackers, like the Triscuit kind that has a lot of fiber in them, other whole grain breads and cereals, whole grain pasta. It might even be helpful to make, I sometimes do this, a batch of, say, quinoa, and then use it for meals or to add to salads during the week. I sometimes like to make bowls where you add lots of these mined ingredients. I think I have a slide on that. And quinoa is just a nice thing to keep in the refrigerator and add to different meals. For beans, because we want to eat a lot of beans, so include them at least 4 meals a week. So here are just some examples. You can use them or make some black bean soup, lentil soup. Chili also is great. This time of year is kind of, to me, chili season, where you might make a nice big batch. You might even make some and freeze it so you can easily pull it out of the freezer during the later weeks. As far as other ideas for beans, salads, you can make bean or lentil salads. Hopefully just some of these pictures will give you some inspiration. And with these salads also, again, if you mix different vegetables and the beans and a little olive oil, it's a great way to get in many of those mined ingredients. Other things for beans, you can make or buy already prepared bean burgers, or you can roast chickpeas with seasonings. They make a great snack, or they're good for adding to salads instead of croutons. You can make black bean tacos or add beans to your taco meat, such as ground turkey. And of course, there's the classic rice and beans, and you can try that with brown rice or even with quinoa or the white rice. The benefit too is when you add beans to foods, and this is for my diabetes part, because they tend to be digested more slowly because all the fiber and the protein, that it makes overall your rice dishes more healthful anyway. And as far as fish, again, salmon, tuna, and sardines are great choices. Cod is another one of my favorite, easy to cook fishes. But try to include fish at least once a week. And tuna, even canned salmon, makes it easy when you don't have fresh fish around. Of course, you can buy it frozen as well. Chicken is very versatile, right? You can bake, roast, grill. You can serve with many of the sides we just talked about. You might even bake or grill a batch of boneless chicken, skinless chicken breasts or thighs to use during the week. And don't forget the rotisserie chickens at the supermarket. Sometimes they're a really just quick, easy way to get some protein for your different salads and meals and bowls. Which here is just to give you some ideas, what we call mind bowls, where I think this is just a great way to use up leftovers from the week, is to make a veggie bowl. You can combine your leftover vegetables with your salad greens, with your proteins that are left from the week, whatever grains you have. You could either put it in a bowl or in a container with a lid, put it in the refrigerator. It's easy to pull out or to take to work. I find that's a great way to use up some leftovers. Yeah, if you always can supplement your vegetables with a handful of the greens, beans, lentils, other grains. And if you just top the bowls with a little bit of, say, nuts or seeds, maybe some dried fruits and a little olive oil and vinegar or lemon juice, sometimes I bring that on the side if I'm taking it to work. It's just a really healthy way to use up your meals from during the week and get some of those mind ingredients in. My favorite meal planning approach is the plate method. And I think the plate method can easily be combined with the mind eating plan. You know, as you can see from this example, half the plate is non-starchy vegetables. Here they actually did a quarter of the plate would be, well, they did the dark green leafy, and a quarter of the plate was the broccoli. So it's really 2 dark green leafies. And then a quarter of the plate would be your protein, in this case, your chicken. And then a quarter of your plate would be your other grains, such as rice. Looks like there's maybe some almonds or some nuts in there too. So it's just an easy tool to use when planning meals and putting the food on your plate. And I found this graphic when I was doing my research, and it combined the plate method with the mind plan. So I like that. And I can put the link. I did copy the link, and afterwards I should be able to copy and paste it into the chat box for you. Or even if you just Google mind eating plan plate East Carolina, that was who provided it based on the original research, you would be able to pull it up that way. I tried it again, made sure it works. So mind eating plan plate East Carolina, but I'll post the link as well. Okay, so it actually has on it a picture of the plate and all the mind foods and the recommended amounts. So I thought it was a good all-in-one version. And then I added this slide. Okay, chocolate is not included in the mind diet or mind plan research. However, I had the slide from another presentation and I decided to add it. For those of us who like a sweet treat, dark chocolate is a more healthful option. It is high in antioxidants. And as the list of benefits shows, it may protect against age-related memory loss. So as with everything, you know, enjoy some dark chocolate in moderation. It has lots of the polyphenols, which are the substances that tend to be helpful for our brain. And the recommendation is, I've read different things. You know, usually they encourage 70% chocolate, but I have read that 60% is okay too, which, you know, I'm going to grab I have a little prop here in my office that I often will use. One of my strategies is after dinner, sometimes when we eat our dinner and we just want a little something sweet after the meal, I think that's actually the perfect time to have maybe a little square, like a 1 ounce or a small square of like Ghirardelli dark chocolate, or there's these, the Moments. Those are really great choices too. But I have these little, hopefully you can see that, it's a shot glass, a 1 ounce shot glass that I got at the dollar store. And I like to put in these Ghirardelli chocolate chips. I find, and again, you know, not that I always promote brands, but these are just really good. And it does have the 60% cacao. And if you put in your little shot glass and afterwards, it just helps because you can eat them one at a time, really savor it, really enjoy it. And I think it just helps to satisfy that little sweet tooth. And plus you might be getting some antioxidants and some other health benefits, such as reducing insulin resistance. It's been shown to increase circulation and blood flow. And you know, even maybe manage weight, because if you have that small amount for a snack, it might help to curb other cravings, and it just overall improves mood. So I just wanted to include that on chocolate. And I always like to end with a few words about eating mindfully, because I think the mindful or mind eating plan and mindful eating, which is another one of my favorite topics to talk about, goes very well hand in hand. And really, mindful eating refers to paying attention to the experience of eating. When we eat slowly and really enjoy our food, we tend to be more satisfied with our meal, and we're better able to take note of our hunger and fullness. And that can be really helpful, because sometimes just eating more than we need, also, we don't feel very good after, and it's easy to overdo some of the nutrients. So tips for slowing down and eating your food slowly and mindfully: look at the food, smell it, taste it, you know, chew it slowly, really enjoy it. Put your fork down between bites, take sips of your water between bites, and just really enjoy the experience of eating. So to sum up, you know, make a plan to include more of the mind foods. Remember that you do not have to follow it exactly to get some benefit. keep in mind that making changes to our eating habits takes time and practice. Small steps can make a big difference. And last but not least, I always say is to be kind to yourself, so if you fall off, get off track, don't be so hard on yourself, just come up with a new strategy to add more of these mind foods. Okay, so we knew that good nutrition was important for our bodies, and now we have another motivation for trying to improve our choices, and that is our brain. Whoops. So I think now I'll close my slides and we can take any questions if there's.
Thank you, Mindy. I just want to remind everyone, if before they leave, I put up the survey, so if you could do the evaluation, and also the link to the recording will be, it's up there and it'll be in there in about a week. We do have one question in the chat box for you, Mindy, and it said, how about Brazil nuts?
I think all nuts are great choices. Yes, I think that would be great too. I'm trying to picture what the Brazil nut looks like. I'm not sure if it's one of those big nuts, but again, a quarter cup or a little, handful, I think would be absolutely.
And somebody did ask a question, actually they just sent it to me, was what about carrots?
Oh yeah, well that would definitely be under other vegetables, right? As far as the vegetables, absolutely. They're loaded with nutrients.
Another question is, do you have any favorite seeds like chia seeds or flaxseed or hemp seeds?
Those are good choices of omega-3s, especially for people who don't like fish or don't get in as much fish, as tends to be recommended. So I think they're great too. They're good. They're high in fiber, healthy fats, a little protein. I like to put the chia seeds in if I'm making oatmeal or overnight oats. Flax seeds also you can mix in. Hemp, yeah, on salads.
Are there any more questions? Dr. Carcia is here also. So if you have any questions for Dr. Carcia, she's here.
I have a question regarding inheritance of Alzheimer's. It's very confusing at this point. Is it or isn't it?
Yeah, that's a great question. I think it depends on the age of the person, sort of the person of interest, meaning there are known inherited forms of Alzheimer's disease that occur in young people. That is a very distinct and different type of Alzheimer's than the type that occurs in 85-year-olds and 90-year-olds. So remember, every 5 years that we get older, the likelihood of us developing some kind of dementia, specifically Alzheimer's, significantly increases. And so there is a genetic link, but it's also, there's a high prevalence in our population as people age. So it depends on the age.
Thank you.
You're welcome.
There's a question in the chat box. Is taking a multivitamin a day worth it for the mind, eating, and the brain?
It's hard to say. I've gone back and forth over whether or not multivitamins are necessary for my whole life and career. Right now I'm on, yeah, sure. I think it's not a bad idea to take it. It's just a little added assurance. I always say that supplements don't replace or substitute, healthy eating and getting the food choices, because foods work best when they're eaten together, that synergy of the different nutrients. And, there's, you don't get fiber. Really, if they put everything into a vitamin that you really need for good health, it would need to be the size of a hockey puck. I remember hearing that and I thought that made sense. But I do think there's a lot of important nutrients, and it might be just good for a little added assurance. I mean, I always notice my nails, everything is better when I'm taking them. So it must be doing something good, in the body as far as when I don't. But Dr. Carcia, do you have any,
I sort of feel the same way. I wobble back and forth. There's no real clear evidence that a multivitamin actually improves outcomes. Again, as a physician, that's kind of my goal. Does it objectively improve some of your individual vitamin levels? Sure. But the biggest thing that I tell people, it really echoes what you said, Mindy, which is it doesn't replace a healthy diet. So you can't really just eat terribly and then take a vitamin and think that that's going to even out. It just doesn't.
Yeah, and I do, but one of the other things I tend to be concerned with is just sometimes when people take too much of the vitamins, because in excess, they can act like drugs and they can sometimes have negative effects. You know, we've seen that a lot with certain supplements that they'll say, you know, it's good for something, and then you hear, oh, wow, but it caused, you know, a problem with something else. So, yeah.
I see a question in the chat about blood pressure meds contributing to memory loss or cholesterol medications too. And I think it's a great question because you're right. There's a lot of information out there. There's also a lot of misinformation. And so one of the things that I said, and then Mindy also echoed, is that any type of insult to your brain is going to increase your chance of developing dementia. Not necessarily Alzheimer's or other kinds of dementia, but anytime that you injure your brain because you have too high of blood pressure, a small stroke, a TIA, which is a mini stroke, you increase your likelihood of having memory loss and developing the dementia syndrome. And so while there may be some questionable evidence specifically about cholesterol medication, maybe some blood pressure ones about how they might contribute to memory loss over time, you're much riskier to not take those medications and to have a stroke.
I just saw one of the questions. Someone said, I don't know if it was directed to me, are frozen bags of peas considered green vegetable or a legume? So I consider like frozen bags of regular peas would be in the other vegetable category. And they're great. You know, I know there's so much fear these days about carbohydrates. You know, people are always saying, you know, we shouldn't eat starchy vegetables, or people are always saying to me, oh, I thought potatoes were bad, or peas or corn, or even, you know, the question about carrots. They're all healthy foods, and they're all can be included within a healthy eating plan. So, you know, and so oftentimes it's portion size. I usually say, you know, with starchy type foods, it's good to try to include or eat them with protein foods, and definitely to focus on lots of the non-starchy vegetables like we talked about, because they do tend to be lower in carbs and calories and loaded with fiber and vitamins, but they can all be included as part of a healthy eating plan.
Mindy, there's one question about how often to eat eggs.
Oh, I'm sorry, what was the question?
How often to eat eggs?
Oh, okay. Yeah, you know, for the general population, they really have uplifted the restriction on eggs. And that's because in the past, they did studies that show that when people ate a lot of eggs, that their blood cholesterol went up. But remember that that's, you know, association is not always causation. What they found was it wasn't the eggs that were a problem, that cholesterol in foods really doesn't raise humans' cholesterol. It's the saturated fat that tends to raise humans' cholesterol. And eggs are actually very low in saturated fat. And we talked about even today about it's the saturated fat that tends to be, you know, a problem with cholesterol and, you know, probably clogging the arteries and causing possible dementia. So they really uplifted the restriction. It's interesting, though, that they still tend to tell people, though, that have diabetes to limit their eggs to probably 3 or 4 a week. But I think they're a great food. Oh, I want to say that it probably wasn't the eggs back in those studies that raised people's cholesterol. It was probably how they were cooking them, say maybe in a lot of butter, or it could have been what they were eating the eggs with. Like if they were eating it with bacon and sausage and those high fat meats, that's where the saturated fat was coming from. So, you know, I enjoy eggs. Hard boiled is a great way to get some fast, easy protein in the morning. They're great for putting in salads, for lunch, even, you know, for snacks. So.
2 other questions. I'll just kind of combine them. What about yogurt, and what about sweet potatoes?
Yes. Yeah. Oh, and it's interesting. I think a lot of people find it's interesting that sweet potatoes, even though the word sweet is in the name, they actually tend to raise blood sugars less than regular potatoes. Again, I have nothing wrong, anything against white potatoes either, but I think sweet potatoes are loaded with beta carotene. They have a lot of fiber. I think it's something we should be trying to probably include more. Some potatoes, though, are huge, right? So if you get those really big sweet potatoes, you might have a half of a potato, share it. I love roasting sweet potatoes. I do that a lot. I actually just made a sweet potato and carrot soup recipe last night. I wanted to use some sweet potatoes. So yeah, definitely enjoy your sweet potatoes. Yogurts, yeah, again, yeah, yogurt's great. Yogurt might not be one of the foods that was included on the have or don't have list, but I think yogurt is a great source of calcium, protein, healthy probiotics, the healthy bacteria. So I think that that's also, a great food to include part of a meal or a snack. And especially if you add some berries to it, I like to. My thing now is to add to the yogurt some blueberries, and I like to buy the sliced almonds that you get in the supermarket, either in a bag or they come out. I can shop right in this little, clear container, and I just love sprinkling it on top of the yogurt. I think it makes a great snack. Yeah. You guys are great. What else? Did I miss anything?
Do you think people should take probiotics?
That's another one of those questions that's hard to answer, which is why I'm sure you ask it, because you're a little confused. Yeah, I'm not sure there's a lot of evidence either way. I think for some people they're helpful if they do have certain gastrointestinal issues. Some find that it helps when you're on, antibiotic therapy, because that kills a lot of the bacteria and you want to replace the healthy bacteria. I would check with your doctor, or if you have a gastroenterologist. It's really hard. What I find hard about it is to know what strains to recommend and what types. So again, I would say, yeah, getting it from food and eating things like yogurt is good too.
Okay. We have time for one or two more questions. Somebody just wrote, should you take them every day? So I think that's the probiotic, because it came right after probiotics.
Oh. Yeah, I'm not really sure how to answer that question. I mean, I think that's usually the way they're recommended, but I would probably ask your doctor if they thought it was something that you needed if you have a particular issue. Some people that do have gut issues, irritable bowel. Dr. Carcia, do you have any comments on the?
I was just going to say it's very individualized.
Yeah.
There's not any clear recommendation for or against them in the general population. There are certainly times when they're beneficial. Antibiotic use is a great one. They make some people feel better, but definitely something individual.
Okay. Any other questions? Okay, well, thank you very much. It was very informative. And I just remind everybody that's still on to please complete the evaluation, because we do read everything and we will use it for future lectures.
Thank you so much for having me.
Well, thank you.
Yes, thanks for having me, and thanks everyone for joining.